Correct.
during open enrollment. Okay,
Well,
cool.
you already take half our presentation.
Well, it's 6:12. Should we begin or?
Yeah, let's go. Yep. Let's do it.
Okay.
Hey, I'm Randy Pickering. I'm with Pickering Insurance Services, Inc., or Pickering Insurance Solutions, whatever you like to call us. And we have the pleasure, as you know, being your financial advisor on the 401k, but we're also your employee benefit advisor on your new benefit plans we're going to go through tonight. I've got Bryce here, who works with CalChoice and Ward & Brown. And I've got Irene here with what we call MOO, which is Mutual of Omaha. And then I've got Lolly, my senior analyst, who basically has put all this together tonight for you. And at this point in time, I'm going to turn you over to Lolly.
Thank you. Well, hello, everyone. I'll be your contact for any questions you have during the year for benefits, ID cards, or any claim problems that you may have during the year. You can always call me or call anyone in the office. We're available Monday through Friday. So we're going to be going over your new benefits starting March 1st. And I kind of want to let you guys know who's eligible for benefits with Home Instead. If you are a full-time employee working 30 hours or more per week, you are eligible to enroll in benefits that are provided to you by Home Instead. The following family members are also eligible for the following benefits: your spouses and domestic partners, children under the age 26. How and when to enroll. Review your benefit elections being offered by your employer. It is required for you to log into the EASE portal, and I'm showing the link here. It's homeinstead301.ease.com, and complete your elections regardless if you are declining coverages being offered by your employer. Make your benefit elections, because once you make your benefit elections, the site will be locked. You will not be able to make any changes, but as Brandy mentioned, you are able to log in during the year to look at your benefits, but not make any changes unless you have a qualifying event that makes you eligible to either cancel your coverage or enroll. All coverages this year will start for an effective date March 1st. What is open enrollment? Open enrollment is a one-time-a-year opportunity in which eligible employees can make changes during to their benefits. For Home Instead, it'll be March 1st, 2022. That'll be your first open enrollment for your benefits. At that time, you can add or remove dependents. You can change medical plans. Maybe you are not happy with Kaiser and now you want to move to a normal medical group within your area. That'll be the time that you can do that. You can cancel or enroll if you previously declined coverage. Changes outside of open enrollment. Here shows a list of all the life events that qualify as a change in status, where you can cancel or enroll in coverages with Home Instead. For example, marriage or divorce, birth, adoption, or death in the family. Also, if your spouse is going through open enrollment, that's the time that you can actually cancel or add your dependents or enroll in benefits. You just need to notify your HR within 30 days of the event. So far, do you guys have any questions?
You're rolling.
Okay.
One of the things I wanted to let everybody know is that we also are putting together for you a Section 125 plan. Basically, any premiums that you pay for your coverages, whether it be on the voluntary side or on the medical side, will come out of your check on a pre-tax basis. So as an example, if your health premium, as an example, is $100, you're in a 20% tax bracket, you're only going to feel about $80 net coming out of your check to pay for the benefits. The government, with the pre-tax savings, helps pay for that other part of it. So I just wanted you to know that. It's one of the other benefits that your employer put in that we really didn't talk about too much earlier today that I wanted to bring up. Lolly, go ahead.
No, I think my part is done. So now I'm going to move. I'm going to have Bryce present the CalChoice.
Thank you, Lolly. And if you could please give me permission to share my screen.
Sure. Okay.
Perfect. Thank you. And welcome, everybody. As mentioned, my name is Bryce, and I'm here to assist with Randy Pickering and his team with going over your benefits for the upcoming year. As mentioned, you will be enrolling this year using the EASE online platform. And I just want to make sure, can everybody see my screen? It should say home instead, and it should be a website. Perfect. Thank you. So you maybe have received this link already. It'll come from a no reply at ease.com. It'll say, welcome to EASE. You've been selected to enroll with your benefits for the upcoming year. It'll ask you to go in and create a new password. I've already done that. So this is the second time you log in. You will input your email, which you received the link to, and you'll put in your new password. From there, it'll take you to your enrollment dashboard. You can select some of these options on the left, but we want to look right here on the right-hand side. You'll see this blue button that says Start Enrollment. From here, it'll just give you a few warnings. It'll say, hey, this is going to take between 15 and 20 minutes. Please have any information that you'll need relevant, such as your social security number, any dependent social security numbers, your date of hire, etc. And if you don't have all the information at once, you can always save your progress and come back at a later time. Now, if we click Start, from here, the very beginning, you'll see there is going to be an overview of how to use this platform. If you forget what I'm saying today, you can always come back and review this video. If we click Continue, moving on, it's going to be like any other online application or fields that you've filled out on the past. You're going to need to go through and fill out all of the asterisks. Specifically, if you try to leave this blank, let's see, I continue, you'll see it'll take you back and say you've missed some information. So every field and every object, especially with the asterisk, needs to be completely filled out, as EASE will then take this information and translate it over to the applications for you. It really is here to make the process much smoother and simpler for you. Now, one thing I want to mention before we move on to the benefits is there's two things that are going to be the most important affecting the benefits that you'll see on the next page. The first one is going to be the age, your birth date. This needs to be accurate as of the March 1st effective date, as this will determine your plan rates. So what we're about to see is going to be the rates for a 31-year-old. The next big question is going to be your zip code, as this determines your plan availability. And the whole goal here is obviously to give you access to your preferred doctor at the least amount of cost possible. So once you've satisfied all of the fields, you'll click Continue. It'll ask if you have any dependents. I've already gone here and put in my spouse. You can also input in your children, as previously mentioned, or anyone else that you'd like to cover onto the plan. It'll ask you basic information about that person, name, date of birth, social security number. This is all information that the carrier is going to require in order to have them be eligible for you. Once you're ready, we'll click Continue. And you'll see the medical plans that are offered for you. Similar to the overview, you'll see this video here at the beginning that gives a little bit more of a description on CalChoice and on some of the options that are given to you today. As I just mentioned, you're going to be enrolling with California Choice for a March 1st effective date. Now, with CalChoice, it's a third-party administrator, and they're an aggregator that brings all of these different health plans together. So previously, you may be familiar with Kaiser, with Anthem, Blue Cross, with United Healthcare, and normally when you enroll on these plans, you need to choose one of those carriers, right? You're stuck choosing whichever plan is being offered to you. But with CalChoice, bringing all of those plans together under one umbrella, I like to think of it as if you're going to the mall with a gift card. You're able to use, sorry, let me back up, your employer is contributing 50% of the cost towards the lowest cost HMO plan. And so you're able to use that employer contribution and use that, like I said, almost as a gift card. You can go to the Kaiser store. You can go to the HealthNet store. You can go to Anthem. You can use, with CalChoice, you can pick from all of those different carrier options. So you do have a huge plethora of different plans available for you today. Looking at the different plans, as we scroll below, you'll see we have HMOs, PPOs, as well as an EPO plan option today as well. There's a lot of different plans down here. Just as a reminder, with an HMO, you have a primary care provider. This is going to be your first point of contact for all medical services. If they deem it necessary for you to see a specialist or seek another opinion, then they'll give you a referral, but you must have that referral before seeking care from that doctor. Also with an HMO, you must stay within that contracted network. Also, we're going to be looking at PPO plans. PPO plans have a little bit more options of choice, but they usually come at a little bit higher cost for your premium. With the freedom of choice, you can self-refer to go in or out of network. You can also self-refer to see any doctor without needing that referral ahead of time. The last thing I want to touch on before we look at the plan options is the plans get broken up into these various metallic tiers. And today we're going to be looking at all 4 options: platinum, gold, silver, and bronze. So you really have the pick of the litter to choose from when deciding what's the best health plan for yourself and for your family. Now, the platinum plans are going to be the richest in benefits, no copays or very minimal, no deductible or very minimal deductible, smaller copays as well, but it's also going to come at a little bit higher cost. The gold plan is going to be a little bit more affordable. You may have some deductibles, but they'll be a little bit lower, and again, more affordable co-insurance as well. The silver plan is going to be your kind of middle of the road plan. You'll have some deductibles involved, a little bit higher cost for your co-insurance and copays as well. And your bronze plans are going to be the cheapest plans available to you, but they also come with the highest deductibles and the highest amount of cost associated with the various services. So using the Ease platform is really great. As you can see, when you are ready to make your selection, you will choose the check mark, which will turn green if you want to enroll, or you'll choose a red X, the X which turns red. If you choose to waive coverage, you'll need to select a drop-down of whatever the options. Maybe you're covered on your spouse's plan, maybe you're a veteran and you're on TRICARE. Whatever that option might be, you'll need to choose some type of reason for why you're waiving coverage. But in this instance, I'm going to enroll. And as I mentioned, these costs down here, as we look at the different plans, they're going to be based off of my current age. So as a 31-year-old, this is the cost that you'll see associated. There's a lot of different plans to look at. So one thing I want to point out is at the very, very top here, under Select Your Plan, you can see a breakdown of the plans and costs. And if you click this blue button, they'll all come up side by side. Now, if you're someone who likes to use Excel, you can export this to Excel and you can spreadsheet them side by side as well. And you can also use the scroll bar at the bottom to scroll back and forth and look at the various plans. Now, I just want to take a quick minute to go through some of these benefits and just explain the best way to read this graph so again, you can make the best decision for yourself and your family. Right now, I'll be using this far left-hand plan, the Anthem Blue Cross Silver HMO B. Now on this plan, if we just go from top to bottom, you'll see you have a $2,000 200 deductible as an individual, $4,400 for your whole family. There is a primary care copay of $60, specialist copay is $110. You can visit the chiropractor or the practitioner for a $35 copay up to 20 times a year. Your hospital facility fee is going to be, you're covered at 45%, so you're paying 45% of the bill. And the outpatient facility fee is a $500 copay. The emergency room is a $350 copay plus 45% of that bill. Urgent care is going to be a $60 copay. And your out-of-pocket maximum is $8,400 for the individual or $16,800 for your family. One thing I want to touch on that always gets kind of glossed over is you will see your preventive care. It's covered at no charge across the board. For every single plan, This is your annual checkup, your men's wellness, your women's wellness, certain immunizations and vaccinations as well. You know, it's important to keep yourself healthy. The carriers want you to be healthy. And so one thing I recommend is every time you go to the doctor, just ask if what you're seeing or doing today could be covered or considered preventive. Oftentimes it can, and it's going to save you on your bottom line. The next thing I want to touch on is the difference between emergency room and urgent care. On this plan, you'll see there is, to go to urgent care, there's a $60 copay. Meanwhile, to go to the emergency room and see an equally licensed medical professional, first you're going to pay a $350 copay, and then you're also going to be paying the remainder 45% of that bill. It's more than likely that cost is going to go way above that same $60 copay you pay for urgent care. So what we like to say is the emergency room is reserved for life or limb-threatening situations. If you're afraid you might lose your life or lose your arm or leg, that's when you go to the ER, because it's going to end up costing you an arm and a leg. Moving on, I want to just quickly discuss the deductible as well. I know it can be something a little trickier if you've ever had to work with our healthcare system. So if I can try to break this down using an easy example with simple numbers, let's say that you were to enroll onto this health plan, the Silver H&OB, and effective March 1st, and a couple weeks later, you're helping take down some St. Patrick's decorations or something, and you happen to fall off a ladder and break your leg. Now, let's say it's pretty serious. You need to go in and seek some immediate care, stay at the hospital a few days, and you walk out of the hospital with a $70,000, $80,000 medical bill. You know, we've heard these stories, of course. Well, first on this plan, you will need to, let me back up and say that the deductible is going to be subject to these services that have an asterisk next to their name. And so on this plan, you'll first need to satisfy the deductible out of your own pocket, assuming this is the first time you're using your health plan. So you'll pay the $2,200 out of your own pocket, and then you'll need to pay the remaining 45% of that medical bill. Now, that's still an astronomical amount of money. Thankfully, on this plan, your out-of-pocket maximum is $8,400. So you'll pay 45% of the bill up until you've paid that $8,400. And once you've paid the $8,400, you could continue to have the worst medical year of your life. You could keep needing to use a doctor, keep needing to use your insurance, but you've met the out-of-pocket max. And so this is the most you will pay in a year for all medically necessary services. I want to take a quick moment to pause, ask if there's any questions or anything I can address at this point. I know it's been a lot of information thrown at you all at once.
I do have a question. So once I'm Maya speaking, if your individual out-of-pocket or your out-of-pocket max has been met, would you still then be required to pay copays and co-insurance or no?
No, not if it's medically necessary services. If it's you going into the plastic surgeon to get a brand new nose or something, you know, that's a elective service, elective surgery. But if it was something, you know, medically necessary, something that you needed to take place in order for, you know, to maintain your health, then you are covered, like you mentioned, for the remainder of the year.
Okay. Thank you.
Perfect.
I have a question too.
Mm-hmm.
So after March 1st, you can't change your plan at all. Once you select gold or silver for whichever company, you can't change it until the next year. I'm guessing we're gonna have to file again the next year.
Yes. So this is the plan that you select for the year, unless you go through a qualifying event. So that's going to be a more kind of serious family status change. So that'd be you getting married, the birth of a child, any full-time changes to your job status, your spouse's job status, some of those, like I said, more serious family events that happen, then you're allowed to change in the middle of the year.
Thank you.
Yeah.
I had a question.
Yes, go ahead.
Which plan should I pick if I use about 5 or more prescriptions a month?
Wow, that is a wonderful question, because that is the very next thing I want to touch on. Is you will notice there is a separate section here for prescriptions. So great question. As far as prescriptions go, you'll see there can sometimes be a separate deductible. So on this plan, you can see There's going to be a $300 individual deductible or a $600 deductible for your family. From there, you'll see that the prescriptions get broken down into these different tiers, tier 1, 2, 3, and 4. Each carrier is going to do it differently. So if you're on this Anthem plan, you might have different tier versus the Health Net plan. You can see there's no deductible over here. But in general, how it works out is tier 1 is going to be your generic drugs. Tier 2 is going to be your brand name drugs. Tier 3 is going to be your contracted non-formulary drugs. And tier 4 is going to be your very specialty medications such as AIDS or hepatitis or things like that. So just like the other medical deductible, you will see that the prescription deductible applies to tiers 2, 3, and 4 on this plan. So for any generic drug, you would go to the pharmacy and pay at the most a $20 copay or $25 copay. I'll get into that in just a second. For tiers 2, 3, and 4, you'll also pay the copay listed after you've met your deductible. And tier 4, for instance, you'll pay this percentage amount up until $250. If it goes above $250, then the carrier will cover the rest. Now, as I just mentioned, you'll see these tiers are broken up by the slash again as well on this Anthem plan. And that's because Anthem has some preferred pharmacy networks. This is CVS, this is Ralph's, your Vons or your Safeway, as well as some others as well. But if you go to these preferred pharmacies, you'll pay the cheaper or the first cost associated on some of these plans. So really great question. I'm not going to go through every single plan line by line. That would take way too long for all of us. But I just wanted to give you some hints and some tricks as to how to read this graph and make the best decision for you and your family as you decide. Are there any other questions about the medical options as we look at them right now?
Well, I was looking at the pay period, the amount per pay period. Is that going to be based on the weekly checks that we get? So the amount will be based on that?
Yeah, so what you see, and again, it'll be reflected based off your age that you put on the personal profile on section 2. But what the price you see is what will be taken out on a weekly basis.
Okay, perfect.
Per your pay period.
Thank you.
Yeah, great question.
Bryce, can you go over, I'm not sure if some of the employees are familiar with Kaiser or Oscar health plan.
Sure. So, I'm sorry, just trying to think real quick. So with Kaiser, you have, sorry, let me back up. With CalChoice, as I've already mentioned, you do have all these different options. You'll see Anthem, you'll see Health Net. Kaiser is another really popular plan. They actually have, I believe, a brand new site in the hospital facility in Irvine. And they are a complete staff model within themselves, meaning their doctors, their urgent cares, everything is provided within Kaiser. So it's a really a great system if you like everything centralized. They're able to take care of everything within house. The Oscar plans are going to be offered through it's called an EPO, an exclusive provider network. It's similar to a HMO. Well, it's kind of a mix between HMO and PPO. I like to think of it as PPO light, in the sense that you are able to self-refer to seek care from whatever type of doctor you'd like. You don't need that referral, but you must stay within that contracted network. So those are good things to keep in mind. Now, whichever plan that you choose to decide on, you will notice that there are these other separate sections for documents underneath. So one thing I want to first really pay attention to is the summary of benefits and coverage. Let's say you've been putting off a surgery, you have been just putting off to going to the doctor in general, and you know you have certain care to take care of through this year. This is a really great breakdown of what you can expect certain costs to be based off of whatever service you might be receiving. So if you have a test, whether it's diagnostic or a CT scan, it'll break down what you can expect to pay. If you're pregnant, if you need to go or need to seek care from a mental health or behavioral health institute, if you want to stay at the hospital. So the SBC, the summary of benefits and coverage, is going to give you, like I said, a better expected breakdown of certain costs. Also, depending on which plan you choose, you may have a certain doctor that you already like visiting and seeing, and you want to make sure you are continuing to see on a PPO plan, or you want to make sure they're within network on the HMO side. you'll see there's these other links here for your provider search instructions, as well as the provider website. So the instructions will give you a little 5-step breakdown on how to do a provider search. And if I could just take a quick minute to explain and walk through doing one for yourself, you'll see when you go to CalChoice, you'll click on this medical providers, a quick little accept. And as an example, if you don't necessarily have a provider yourself, you can put in a zip code. And on the left-hand side here, you'll see all of these separate filters on where you might want to search from. As an example, I'll put in St. Joseph's Hospital. I know that's a pretty popular facility up in Orange. If we go, excuse me, must have clicked the wrong, there we go. And you are able to see over 500 physicians found that are accessible through St. Joseph's. Now, you'll see, again, I just searched using a hospital. If you have a specific doctor, you're able to search them up as well. Once you find the doctor that is yours or you like to enroll with, you can click on the drop down on whichever plan you're searching for, whether it's HealthNet or Anthem. You can see the various medical groups they're affiliated with, and you can see their provider ID, which will be relevant if you are enrolling on an HMO plan and would like to stay with that provider. So once you've made your selection and you've looked at all your relevant documents, you'll see it automatically chooses and updates on the right-hand side here of your running total. I'll go back to my plan right here. And you will click to continue to enroll. Now, it is going to show the Mutual of Omaha benefits, which I will turn over to my colleague in just 1 minute. But just so I can show you exactly how this works to enroll and sign your forms, I'm just going to go through and enroll in all of these plans. Again, you'll get a better breakdown of the benefits on these plans in just 1 minute. But I want to show you how to complete your enrollment and sign all your forms. So once you've made all your selections, it'll take you to the summary page. It'll show you a running total of the coverages you've decided to enroll with. Once you're ready, you click continue. When you're ready to sign the forms, you can click sign forms. I will say though, if you haven't clicked on all of the relevant plan documents, it may say, hey, please go back, please view this document. We just want to make sure that you're familiar with the plan you're deciding and making sure that this is the best choice for yourself. When you are ready to sign forms though, please click sign forms. You will see this pop-up come up letting you generate an electronic signature. You can first type it out and then try with your best cursive. I recommend using a tablet if possible. Please do your signature. When you are ready, it'll take you to these green boxes. All you need to do is click once. It will automatically sign your enrollment forms and waiver forms for you. And then when you are done, it will take you to the top. You can click the finish signing on the blue button on the top right-hand corner. It'll ask you to feedback. Click one more time to make sure you're completed, and it'll take you back to the beginning page for your open enrollment. Once this has been signed, your benefits have been locked and enrolled. This portal will be open for you until next Friday, February 12th. Please make sure you have made all of your decisions by then. Come midnight on the 12th, everything will be locked, it will be pulled, and your decisions will be finalized. So I just want to make sure that, again, everything has been completed at that time. Now, I just want to take one more moment and just open the floor up for any extra questions that you may have about your medical insurance or enrolling on ease or anything of that nature.
I have a question.
Absolutely.
Is there any dental or vision offered?
Randy?
We haven't proposed it at this time, but
Okay.
that's something that we can easily add as a voluntary benefit, or it could be a split with the employer.
Is that something you'd be interested in?
Dental for sure.
Okay.
We can get some stuff on a voluntary dental plan, and it's easy to get it in the future months.
Okay, cool. Thank you.
Well, thank you. And now I'm going to turn it back over to Irene with Mutual of Omaha to review some of the other ancillary benefits.
Thank you.
All right.
Oh, hey,
great.
before Irene gets started, what's unique about Mutual of Omaha
Besides the Wild Kingdom,
besides the Wild Kingdom? What do you think, Val? I'm putting you on the spot, Val. Then I'm going to put Maya. Then I'm going to end with Wendy and Olivia. What do you think? What's important about Mutual of Omaha? I can't hear you, Wendy. You're muted. You're muted, Wendy.
Unmute. Unmute.
I sound better that way. On Sunday evenings, they always had their TV shows.
All right. The
Remember
thing
those?
is,
I mean, I'm dating myself.
all right. So where's Home Instead headquartered? Omaha. Okay, that's it. You guys. Okay, it's late. I know.
I think they passed with flying colors.
All right, there you go.
There you go.
It's
I
our,
appreciate
they're
that.
homies with us. They're homies.
Okay. Lolly, looking at request. Let me share my screen.
But everybody knew Big Jim and Marlin from the Wild Kingdom.
That's exactly right. You're dating yourself, Randy, as well.
Well, I did. You know, when my rep come in, who's works with Irene, I go, "Did you ever watch that?" And he said, "No, I had to go to YouTube to figure out what the hell you were talking about."
All right.
That's so great. I love it.
Okay. Can everyone see my screen now? Great. All right. Thanks, everyone. So good evening again. Irene from Mutual of Omaha. And thanks everyone for really joining the call. Really appreciate it. Bryce did a great job going through the ease portal. So he elected some of the benefits and showing you how easily it is to enroll in the benefits. But I'm just going to give you an overview. And the difference between our plans and your medical plans is the open enrollment on these benefits isn't something we offer every year. So even if you don't have medical insurance with the company, maybe you have it on your own individually through a spouse or whomever, you can still enroll in the Mutual of Omaha benefits. That means that during this special open enrollment, there'll be no medical, no health questions required from you. And it's not something we offer every year like the medical. So make sure you take advantage of these benefits. And you get great rates because, again, they're a group rate. So anytime you talk about discounted rates, I basically compare them to like going to Costco, right? You're going to get a better product and it's going to be a lower rate. So when I'm going to start off with the life insurance, if you don't have any life insurance outside of the company, you really want to make sure you consider it. I tell everyone you should have at least a little bit of life insurance. And why? Most of us think of expenses when someone passes, and the immediate expense most of us think about is a funeral. Funerals nowadays can cost between $10,000 to $15,000. I mean, really the reason why GoFundMe is who they are today is because people don't even have enough to cover those expenses. Life insurance is not to make anybody rich, but to make sure you cover those expenses. So maybe you're single and you're thinking, I don't really need a lot of life insurance. I would say at least consider the bare minimum of $10,000. And again, because of the no medical or health questions, your health can change overnight. And if 2020 didn't show us that, I don't know what will, because you get diagnosed with anything, maybe COVID or high blood pressure or anything like that, it's really hard to get life insurance on an individual basis. So here's your opportunity, no medical or health questions during the open enrollment. If you're married, have kids, you especially want to look at life insurance a little bit more. Well, how much can you sign up for? I know through the Ease portal, you had some options, but just to let you know, as an employee, you can enroll in a minimum of 10,000. The maximum you can sign up without any medical or health questions, again, regardless of any pre-existing conditions, is up to 100,000. So the policy is available in 10,000 increments, meaning you can do 10, 20, 30, 40, whatever's right for you and your family. And if you enroll in the benefit yourself, you can actually cover your spouse and your children under the plan. Minimum for your spouse is 5,000. The amount you can elect for them with no medical or health questions is 25,000. And for your children, minimum is 2,000 and the maximum is 10,000. Any amounts over the amount that is guaranteed, whether it's 100, 25, or 10, will require a small health questionnaire. So you can go over these amounts. Just remember, it's a small health questionnaire you would fill out in the EASE portal. It is life insurance that'll pay out if you pass away for any reason, accident, sickness, injury, natural causes, whatever the situation may be. And the reason I also tell you to at least consider that bare minimum of 10,000 is if you enroll in 10,000 during the special open enrollment, every year you can increase your life insurance without any medical or health questions. So maybe you're single and you have a qualifying event, you get married, have kids, whatever the situation may be, you can now increase your life insurance from 10,000 to 100 and add your dependents on. The plan is also portable, so in the event you ever parted ways with the company, it becomes your individual policy and it stays at a group discounted rate. Rate information is in the EASE portal because it is based on your young age and wherever you fall in that age bracket. But I also wanted to show you, because I know sometimes we go through the system really quickly, we want to get it done and over with, how inexpensive the plan is. So everyone in here is pretty young. I'm going to go ahead and just use 40 as an example. You are young 40 and you want to enroll in 10,000, it would only cost you 39 cents a week. So these are weekly deductions. So for a lot of you, it's maybe $1 or $2 a paycheck to have that bare minimum of $10,000. That gets you into the policy and you can increase it later. For your spouse, it's actually based on your age as well. So you're 40, you want to enroll your spouse, it would be another 39 cents. Children are covered up to the age of 26. It's 42 cents, and that's considered a unit rate, meaning regardless of the children that are covered under the plan, 2 or 3, it's still only going to be 42 cents a week for that benefit. So I'm leaving it at that. Is there any questions on the life insurance? Anything I can answer for you?
Get it before we go paragliding, everybody.
That is the reason why this is being offered, because Jim is pushing everyone to do that.
I have a question.
Yes.
Just a completely honest question out of my own young naivety. I don't really know what the difference is between health insurance and life insurance, like what kind of things life insurance would cover. You know.
Actually, that's a great question, Valerie. At the age of 18, I thought, well, why do I need life insurance? And the reality is life insurance is a benefit when you pass. It's really for your loved ones. I would say you get life insurance because you love somebody. So if something happens to you, right, now someone's going to be responsible, even though you think they might not be, to take care of your funeral or cover any expenses you leave behind. So even when you're young, I always say that's why 10,000 is always a good amount, or 20,000, because you're going to leave that expense behind, whether it's a $10,000 or $20,000 funeral expense, because that's what they go for. So you want to make sure your family at least has that amount to cover, right? So they don't have to worry about those final expenses. As you get older, you know, you get married, you have kids, 10,000 is probably not going to be enough because you worry of what you're going to leave behind. Maybe you have a mortgage and now you have kids and you want to make sure they're taken care of, right? To leave something behind for them. So when you're married and have kids, 100 to 200,000 is probably what most people look at. But the reality is you're young, you're single, most of you will do $10,000 or $20,000. And again, because if something happens, you get diagnosed with something, whether it's a condition, a medical condition, it's really hard to get life insurance once you're diagnosed with something. So, I mean, if you can sacrifice, I'm going to go ahead and pick on you, Valerie. You look young, you could do $10,000 for 23 cents. I mean, I don't even know what you could possibly buy for 23 cents, not even a bottled water, right? But you can get some life insurance for that amount.
Irene, I think you're cutting off.
I'm cutting off.
Hear you.
All right. Is that better?
Yeah, absolutely.
Okay.
Yeah.
Valerie, did you hear most of that? Or we can
I
talk
heard
on
all
an
of it.
individual basis.
I have a question.
Yes.
Are you limited by what the person that you leave this to can spend it on, or can they spend it on whatever they want? Like credit card debt, you know, whatever you leave behind, I guess.
Very good question. The money is paid to them directly. It's a lump sum and they can utilize the money for whatever they want to.
Okay,
Mhm.
thank you.
And then one last question. So if I started it now, like at 10,000 or so, it wouldn't go anywhere. I could just have that for the rest of my life and just kind of increase it to 20,000, 30,000 as I get older.
Yes, every year, if you'd like, you can bump it up by 10,000 every year till you get to that 100,000
Thank you.
without any medical questions. Great questions.
I have a question.
Really good questions. Yeah, Olivia.
Um, for the person who receives the money, do they have to be directly like a domestic partner?
No, actually, you can list anybody as your beneficiary. Just remember, which is a great question, to keep your beneficiary updated, right? We list somebody, our heart changes, so should our beneficiary. So you want to make sure every year we'll remind you. When we do these open enrollments, make sure you have your beneficiary updated, and you can do that anytime during the year.
Okay, thank you.
Do the beneficiaries have to be of age, or can you leave it to children?
Very good question. If you do leave anyone under the age of 18, it basically stays in a savings account for them until they do reach the age of 18.
Is there interest on that savings account?
Yes,
Yeah, there
correct.
is.
There is. Mhm.
Little.
Okay.
Little.
Yeah.
A little bit.
Yeah,
That's good.
it's a
So
little
it
bit.
would grow until they could get it, but they wouldn't have access until they were 18.
Correct. And you can
Okay.
always list more than one beneficiary if you like. So
Is it
sometimes
then-
people do that is they list a guardian, right? Someone that's over the age of 18, and then they'll list a dependent and provide 50-50. You can split your beneficiaries.
Okay. And then the increments of 10,000 each time, can you jump from like 10 grand to 60 grand without a medical?
Only if you had a qualifying event. So if you got married, divorced, birth of a child, that allows you a qualifying event to go from 10 to 60 during that time.
Okay. So otherwise it's yearly that you can upgrade it.
Correct.
Okay. Thank you.
Thank you.
But it's just a quick question, but it's not 10,000 yearly, is it? You can go any amount every year?
So 10,000 you can bump up every year without any medical or health questions.
Okay.
But anytime during the year, if you wanted to increase it, we would require a small health questionnaire. But you can go from 10 to 100,000 if you provided us health information.
So that's
So
why
at that-
that's why this first one's important, correct? You know, in other words, get that amount up as much as you're comfortable with, but get that, because then if God forbid your health changes, then you could be in trouble. At least now you have it locked in.
Absolutely. That is
I
right.
see. I see. So each year, so I couldn't start at 10 and then next year want to up it to 50. I would have to go through the stages of 20, 30, 40, 50 yearly
For no
Yes.
health questions, right?
With no
without
health,
health questions.
you could make a bigger jump, but you've got to answer health questions.
Irene, what's the guarantee issue?
It's 100,000.
100, yeah.
And you can always decrease it at any time. So maybe you do start off at 50 and you go, you know what, I don't feel like I need that much at this point. You can always decrease your benefit anytime during the year.
Anytime. Okay.
So for anybody that's had any kind of issues, major issues, now would be the time you could buy 100,000, no questions asked, and get it and have it. So, you know, that's another good thought too.
Because
What are some of the questions? The health questions?
Well, if you buy up to 100 now at the beginning, there are none. If you go over 100, have you been hospitalized in the last 2 years? Are you on any kind of medications, and some simple questions like that?
Blood pressure? Do you smoke?
Yeah.
Kind of thing. Yeah. Okay.
Yeah, basic info. Mhm. All right. Is there any other questions, team, on any of that?
really good questions. I'm impressed.
I am
Blowing me
too.
away. Man, boom.
Caught me off guard this evening. I was like, oh, okay, let me think about this. All right, I'm going to move on to the disability insurance. And I think you guys understand how life insurance works. Something happens to you, the money's paid to your beneficiaries. Disability is like one of those benefits that we don't understand how it works or how it's going to benefit us as an individual. But I always say second to medical insurance, if you ask most of us that work in the industry, we're going to say disability has to be the most important insurance you can have. And the reason why is we're talking about getting insurance on your income, your paycheck. I mean, that's the reason why most people consider this so important. We don't think about it until we've actually had to utilize the plan. So the reality is we get insurance on anything that we think is important. Our cars, our phones, our cell phones have insurance, our health, that's why we get health insurance. All these things that are important to us that bring value, we're going to insure. But without our income, none of that is possible. So that's why I always tell individuals really want to consider this disability insurance. And disability is very difficult to enroll in on an individual basis. It's really sold through groups, larger companies, and you're giving a great opportunity with the company to enroll in this benefit. The first benefit on disability is short-term disability, which means if you cannot come to work because of an accident, sickness, or injury, anything that happens outside of work, that can mean anything as you get pneumonia, right? Pregnancy, whatever the situation is, you need to have surgery, we're going to go ahead and pay you a benefit while you're out. And the reason why is the last thing you want to do is worry about your finances when you're sick. And that's the whole purpose of disability. Make sure you stay afloat while you're out of work. So the benefit will pay you after the 8th day. So once the doctor says you're unable to come to work, the first 8 days you'll use your vacation or anytime you have available, that'll count towards that. After that, we will pay you 30% of your weekly salary, which is tax-free, up to $1,000 a week. 30% doesn't seem like a lot, and you're thinking, well, that's not a lot. But because as a California resident, we automatically get state disability, which is about 60% of your weekly salary. We're going to pay this on top of your state disability. So you're looking to get about 90% of your weekly salary tax-free, which is pretty much what you take home already. So while you're out, you're getting an earnings every week. You're making the same amount while you were out that you were while you were working. And so people don't realize, like, the state's great, right? But it's still only 60% of your salary, which most of us require 100% nowadays to survive. Once you collect on the benefit, you don't have to pay the premiums. They're automatically waived till you come back to work. And it is open enrollment, no medical or health questions. The thing that I do want to point out is we have a pre-existing condition. I know it sounds like, oh, here's the catch, but it basically means if you went to see the doctor, took medication 3 months before the policy started, we're not going to cover that condition for the first 6 months. So let me use myself as a good example. I have lupus. I take medication. My lupus isn't covered for the first 6 months. After 6 months, it would be covered 100%. So don't let that discourage you from enrolling because you think, oh, I have high blood pressure or any other reason. It should be completely the opposite because this is your open enrollment. We're just saying the first 6 months, that pre-existing condition is not covered. But everything else would be covered on day one. Questions on this short-term disability?
You had said that this is tax-free, but when you file for taxes, don't you have to pay the tax on it at that point?
Well, you're actually paying taxes on the premium, which is a minimum amount already. So when you collect the benefit, you don't have to pay taxes.
Cool.
So, Any other questions on this short-term disability? And a lot of people worry about the process of filing a claim. It is really easy to file a short-term disability claim. So just to let you know that the claim forms are actually, I believe, also Lolly puts them in the ease portal. So they're easy for you to, if anything happens, to fill them out. You can always contact us directly as well. So what if your disability goes beyond the 25 weeks and you're like, what do I do now? How am I going to handle this situation? Well, we do have what we call long-term disability. So short-term disability covers you for the first 25 weeks. This will cover you after short-term disability ends. So basically, it's a seamless transition. If you're enrolled in both plans, you'll automatically roll over to our long-term disability. Our long-term disability will pay you 60% of your monthly salary to a maximum of $5,000 a month. And it'll actually pay you up until Social Security retirement age, whatever age that is for you. So this is there to cover you for the long term. You get diagnosed with cancer, you have a back injury, anything that's going to put you out for more than 25 weeks. They're two separate benefits. Employees always ask me, like, which is better? Should I sign up for the short term or the long term? And if you ask me, I always say, if you're the sole provider, meaning you're the ATM at home, I would highly consider both plans to make sure you're covered from the start to the end. Short-term disability is great if you're planning or maybe not planning to have kids, but you're at the age where it's a possibility, always something to consider. Long-term disability, if something runs in your family like cancer or anything like that, always something to consider, right? So those are things you have a choice to do, just a short-term or long-term, things to think about when you're considering both options. Is there any questions on the long-term disability? Okay, and you can enroll in both benefits. The rate information, I know I've listed it here on a weekly, but it's all in the ease portal. There's nothing you need to do because it is based on your salary information and your age. So when you log into ease, it'll automatically generate that information. Make sure you look at it because, again, great opportunity for you to enroll without any medical or health questions. Last thing I want to go ahead, I know you're getting all this assistance with Lolly helping out with the enrollments and all that, but just remember, if you need additional assistance, we're also going to help with that. We have a specific link that you can go to, and myself or one of my colleagues is going to be available tomorrow from 12 to 8. How exciting. And on Monday from 12 to 8 p.m. I know you guys work late, so we want to make sure that we accommodate you. So all you have to do is click on this and check off the date, whether it's the 5th or the 8th that you want assistance with. And it's about 20 minutes appointments. Enter the time, your name, your email, and your phone number so we can text you. And you're basically going to click on book, and that'll schedule you an appointment if you need any help with your benefits. And that's all I have. Thank you.
Awesome. Thank you.
Thank you, Irene.
That pretty much wraps it up. Jim, any comments?
Yeah, you guys, look, these benefits are there for you all, and we're proud to offer them. And if you have any questions, you've gotten the information, you've been bombarded with information. I get it. Just take it one step at a time and you'll be fine. But, you know, just this is great stuff. So hopefully you're excited and great questions.
Very good questions.
Yeah.
All of us are here to help you. You've got a great benefit package. You've got a great employer. We're going to love working with you. We're going to be there all year long. This isn't just we come and enroll you and clip coupons the rest of the year. We're always there. We'll be there for you. You've got a claim problem or a doctor getting in to see somebody or a hospital issue. We solve those kind of problems. That's what we're for. We're your advocate.
That's great.
Thank you, everyone.
Yeah.
And it gets pretty tight.
All right. Thank you guys. Have a good rest of your evening.
Hey,
Thank you.
adios.
Thank you.
Thank you very much.
Well
Bye,
done.
everyone.
Thank you.